Dr. Sterry, endoscopic brow lifting is getting a lot of attention right now. Can you explain what that is and the benefits to a beauty seeker like me?
Yeah, with an endoscope, we can shape the brow and sometimes lift it. It doesn't always have to be a lift. Sometimes we're focusing really on just changing the shape of the brow through very small incisions that are well within the hairline. Now, in the old days, say in the 80s, the only way we really had to perform a brow lift was to make an incision like so. It's called a coronal approach, and literally fold the skin down, tinker with the muscles, pull it back up, cut out a bunch of hair bearing area, and close. Um, that is quite old fashioned, and there are very few people that would have need for that anymore. In the mid 90s, the endoscopic brow lift came along, where there were small incisions inside the hairline. And using the instruments that I described with the endoscope, we were able to lift the brow and sort of suspend it a little bit higher. The problems that we ran into were severalfold. One, it was way too easy to move the middle portion of the brow, and that's why so many people walked around looking surprised all the time. That was obviously not a cosmetically great look. The other thing was the suspension of the brow and getting it to stay in place. That we used to use screws in the skull. There's all kinds of drill holes in the bone and suture techniques and whatnot. And that really gets to be a little bit frustrating. The big knock on this procedure, and right around the year 2000, 2001, I think, was that it didn't hold up. That, you go through all this effort and it lasted about 18 months, and then the patient's brow was back down where it was before. What we think was, in retrospect, what we think was going on is that there was an incomplete release of some of the attachments all along the orbit here. And so nowadays, the thinking is that if you make sure with the scope, if you know what you're doing, and you make sure that you release this zone, then you're able to get a nice elevation and you almost don't need any suspension. In other words, once the release is done, you sort of put the tissues where you want them to be, and they tend to stay there a lot longer. And it seems like this is really starting to take hold, and there is a lot more research nowadays proving that this is the case.
I didn't realize the endoscope had been around since the 90s. Did I hear that correctly?
Yeah, yeah. Oh, yeah. This is Renato Saltz and a couple of other folks. They were really trying to develop this and tinker with it and get it right back in the 90s.
Because you're actually putting a camera inside the body.
Well, you're putting the camera is actually at the back of the scope, and then there's a fiber optic piece with the lens at the tip that goes underneath the skin. So the bulk of the camera is still outside the body, but the lens is long as think of it as a long tube, a long piece of glass, and that's why you can see what you're doing from far away.
Okay, thank you. That makes sense.
Yeah.
Dr. Sterry has been awarded excellence in teaching by his surgical residents at Mount Sinai, not once, but 3 times. And he just told us why the original endoscopic brow lift approach failed and the one thing that changed everything. Now, stay with us because at the very end, he's going to tell us about one part of the face where he's still watching and learning about the results of an endoscopic surgery. Dr. Sterry, welcome back to Beauty Seek.
Thanks so much for having me.
A dropped brow changes the entire upper face. How much does brow position affect the way the patients that you visited with and worked with, how does it affect their self-perception and themselves about aging?
That's a tricky question because I'm not sure people realize how much it affects their perception of themselves. People don't pick up on that. Many times people think that it's their upper eyelids that are the problem, and they don't realize that it's their brow. So that's why it's a little bit tricky for me to answer. But it clearly, if you look at some before and afters, it clearly rejuvenates folks and really can make someone look much more like themselves, 10, 15 years ago. Uh, Lifting the brow, especially the lateral portion of the brow here that we call this the temporal brow, it makes a huge difference in how someone comes across and their age and their vitality, if you will.
Okay. This is all very interesting because I got an upper lip years ago. And while I was in I think it was the day before I was getting the surgery, the surgeon was trying to get me to do, an upper brow lift, and I couldn't see it. Well, he was holding one eyebrow up. And I just was like, I have not done enough research on this, but it sounds as though, I mean, it could have beautiful results. And maybe I didn't need the upper lip, I needed the brow lift.
Uh, that happens more times than you may think. Sometimes I have had the experience where, despite my advice, I was forced, I agreed reluctantly to perform upper lip blepharoplasty and take away some of the skin that was cutting. And what happens is that their eyes don't look much different afterwards, but the wrinkles on the forehead go away because they're no longer lifting their brow like this, trying to keep the lid skin off of their eyelashes. It's called compensated brow ptosis. This is a real thing. I see it regularly. I have it myself, so I know quite a bit about it. And it really is an issue. So, when you ask me on a scale of 1 to 10, how much does it affect? Well, I don't think people are really aware of it. You just gave us a great example in your own face.
It's an unknown. Yeah, I had no clue. Okay, that's fair. We're gonna have to dig into this someday here. Um, okay, as you said, the original endoscopic brow lift it got abandoned by many surgeons because results didn't last. But
I
then,
think people got frustrated. They got frustrated by the longevity. They got frustrated by the need to maintain so much equipment. The endoscopic equipment is bulky and bothersome. Uh, and then it also, in fairness, the public kind of gave it a bad rap because there were so many people walking around with a surprised look. So more and more people said they would never have a brow lift, not realizing that a well done brow lift can be very nice.
so do you think then that had to do more with the technique or the vision of what the brow lift could be?
I think it was the technique. So the folklore in this area is that there was a paper written right around 2000 or two, I think it was 2001 actually, happened to come out of a New York hospital, and they basically said, this technique doesn't really work. We're just going to do these open. It's not worth pursuing. From reputable surgeons, very reputable surgeons. And the scuttlebutt is that they weren't really completely releasing the ligament over here on the side of the orbit, and that's why their results weren't lasting. So the real hardcore endoscopic brow lift people started to refer to this as the New York ligament because it sort of killed their procedure, and they blamed the New York surgeons. Again, always remembering I'm a New York surgeon. um, but this is the, as they say, the lore of what went on. How much of this is true? Hard to know for sure. I wasn't in the operating room, but this is what we talk about.
Okay. Now, do you perform more of a modified brow lift?
I do. Generally speaking, I do. I am very intrigued by Fausto Viterbo's work on the gliding brow lift. I also appreciate Alan Matarasso's point about a little bit of skin removal. And so I actually perform a procedure where not every time, but many times, where I'll make a hairline incision here, undermine the skin, elevate the brow to exactly where I want it to be. And then Viterbo and Andre Auerswald demonstrated to us that we can sew the skin and the brow down to the exact place we want it to stay, leave those sutures in for a few days, and take them out before they start to leave marks. Uh, and the longevity is surprisingly good. When you see some of these blinding brow lifts compared to some other folks, depending on their technique, the longevity is terrific. I mean, years later, the brow really does stay where they wanted it to go. I have my own little theory about that. I think it's because you're no longer trying to fight against the musculature that's constantly pulling our brow down and bringing everything lower. So what we're doing is basically just resetting the area that the brow, the hairs in the brow and the skin here intersect with the muscle. So the muscle can go to hell with itself. We can do whatever it wants, but the brow is going to be in a position that we like. And it's been very effective. It works very well. Now, again, I want to repeat, it's not the only technique I use, but I have found it to be very useful.
Now, I might be taking us down an incorrect path here. Let me know if I am. But you talked about suturing and then taking out the stitches after a couple of days. Is that the kind of the theory behind a hemostatic net, or no? Different discussion.
Yeah, no, it is the hemostatic net. That's why I mentioned Andre Oswald. So, uh, Andre Oswald came up with the hemostatic net way back in like 2012, but it didn't really catch on until the last few years. And basically, what he proved is that you can advance skin, tissues in general, and if you sew them down, you are far less likely to get a hematoma that's bleeding underneath the skin, which happens 2.5% of the time in facelifts, 5% of the time in male facelifts. And so it's a valuable technique. But what started to happen as we were watching these things is that we also think that those tissues that were sewn down, each one of those little suture areas acts like a spot weld, and the tissues start to stick in that zone, which is why Fausto V. Turbo in Brazil turned around and said, well, why can't we use that in the brow area? And that's where he came up with the concept of the gliding brow lift. So he's separating the skin from the muscle, elevating it, and then sewing it back down to a new set point. And it works very, very well.
Amazing. And, uh, it just looks so scary. When I started seeing that, I only started seeing them online like a few months ago. And I thought, what is that? And why does it not cause any kind of scar?
So your body starts to deposit collagen around those stitches around 5 days later. So you've got a few days to play with. You got a few days for things to start to stick and stay in position. Uh, and it really does work very well. I haven't had any of them leave marks. And to your point, yes, when I first saw it, I know when it was. It was January 2020. I thought to myself, what are you crazy? I could never do that in New York City. I'll be running out of town. I'll never get another facelift patient again. I, and frankly, I have to go to a lot of boutique meetings, and there's a lot of foreign trained surgeons at a lot of these, and they start to tell me, no, you got to try this. You don't understand what you're missing. One guy told me that he doesn't worry about hematomas, about bleeding after a facelift at all anymore. In fact, he did a facelift, put the net on, and got on the plane. He was just not worried about the patient. And I thought, wow, that's pretty crazy. I would never do such a thing. But just for the sake of being able to sleep at night and not worry about the patient was very satisfying. So I slowly started to back into it. I started to do a little bit on like the neck area in a small zone if I was doing a neck lift, that sort of thing. And when I proved to myself that there were no marks left, then I moved on to like different skin types and such. I actually had this conversation with Auerswald, and I explained to him, I'm in New York City. I treat every type of skin under the sun. I cannot afford to have stitch marks show up. And he looked at me and he kind of chuckled to himself and he said, Tom, I'm in Brazil. Are you kidding? Do you know what the skin I deal with? No, trust me, it won't leave a mark. Just go ahead and try it. So I did. He was right. It's fine.
Amazing. Is there a skin type that maybe you think, oh, I might not do the hemostatic nut, or no,
Not
just take
anymore. And, well, not anymore. I might have hesitated in the past with type 4 skin. Sometimes people talk about African Americans are always concerned they don't want marks. I get it. Asians, same thing, but I haven't had a problem with anybody yet.
Okay. Yeah. My friend is Asian and she will not touch and she will not have anything done with her face. um, so patient selection for a brow lift is how much more important is that than the technique itself?
Yeah, and that's a good question. I suppose you're right. I think that there are so many different ways to do things in plastic surgery. If you have 10 plastic surgeons and you ask opinions, you're going to get 45, 50 different opinions because there's just so many right answers. So I think that any of these techniques, if done well, can give stellar results.
So, okay, as you said, most patients don't even understand that a brow lift would give them the results as compared to, an upper cleft. What questions could they ask to understand if that would give them a better result?
Look, sometimes they're afraid of looking surprised for the rest of their life. Um, they might want to ask, what happens if my brow is too high? Can you lower it? The answer is yes. Um, Again, they might want to ask things like, how many of these have you done? Uh, they might want to ask more about the technique, um, those kinds of questions. But if you're going to a surgeon and you see their results, you say, "Look, show me someone else who resembles me to some extent. What does their brow lift look like?" That's probably the best question.
And should all surgeons just have a portfolio of photos, whether they're online or they're in their office? Is that something that should just exist?
Yes, it should. The problem, of course, is privacy and rights, and patients have rights. Um, if I was doing kitchens and baths, I'd have a thousand times more photos than I do that are available for people to see. But it's their face, and not everybody's willing to let me show their pictures to future patients, um, which I understand to a certain extent. Um, but they do have that privilege. I can't tell you how many patients come in when I'm taking preoperative photographs just to document where we're starting. They'll say to me, "No, no, no pictures. I don't want them online. I don't want this. I don't want that." And I have to explain to them the HIPAA laws and let them know that, no, this is in your private file. No one will ever see them unless I someday ask you for permission and you sign them off to me. But otherwise, everybody on my website, everybody whose pictures are in my office, I have permission to show those.
It's such a wonderful thing for a patient to agree to that. I mean, it's such a personal thing where I think I probably wouldn't have shared my photos, but would that have helped somebody else in the future make a decision that was, they needed those photos for some reason?
Yeah, exactly.
Beauty seekers, here's what we just learned. Dropped brow is often misread as an eyelid problem. And the original endoscopic approach failed because surgeons were not releasing one specific structure, the New York ligament. And when that changed, the results changed. Dr. Sterry, patients who had a brow lift that fell now know why one ligament was left unattached. Before a beauty seeker books a brow lift, do you think it's wise to ask candidate surgeons if they release the New York ligament?
Well, I don't know that I would ask it quite that way, but but yeah, look, again, it is technique dependent. So if you're having an endoscopic brow lift, um, you should be confident that your surgeon is going to do a complete release all the way across, and asking the question is fair. And an honest surgeon will explain his technique. As I mentioned, there are other techniques where that's not even on the table. It's not an issue whatsoever. So sometimes if it's a skin only or a gliding brow lift, you don't have to even ask the question.
Okay. And that's a tough thing. I'm glad you said I wouldn't ask it just like that because as a patient, you know, uh, I, I totally respect the amount of schooling and education and background that a surgeon has. So where do we, kind of where does educating myself kind of pause and then trusting this person that I really probably have just met?
Fair. I'm in a very strange business. I mean, people come in, they chat with me for 20 minutes, and then they're willing to lay down on a table and let me say something sharp and do some very impressive things. So, yeah, you're right. But they have to ask that they really do need to know. They deserve to know what they're getting into.
Beauty Seekers, thank you for being part of this community. Every subscriber is how we keep bringing you surgeons like Dr. Sterry, who explains the why, not just the what. Coming up next, Dr. Sterry gets honest about the mid-face, the cheeks, the area many women would say they care about a lot. And hang out with us until the end because Dr. Sterry is going to tell us something about the newest surgical approach, endoscopic, that you probably want to know before you book your surgery. And that's what I would want to be told if I was considering a mid face. Your you're kind of taking a gamble, I guess, right? It gives great initial results, and we just don't know for sure if it's going to last.
Well, yeah, we don't know the longevity. It may not last as long. Maybe it will. We just don't know yet.